We all know addiction and substance use disorders are a huge driver of disparities, right? We know a lot of the risk factors that drive poverty, inequality, racism can also increase the risk for substance use. And then, of course, there's decreased access to care as well. And so by creating a more just, better system and addressing addiction and substance use and recovery, we have an opportunity to improve care in our society.
Hello, everyone. Welcome back this week. It's Dr. Erkeda, and I'm here with another fabulous guest, Dr. Michael Tang. I'm just going to give you an opportunity to tell the audience a little bit about yourself and your journey to medicine.
Awesome. Thank you so much for having me today. I really appreciate the opportunity. So my name is Mike Tang. I'm an adult and child psychiatrist, addiction medicine doctor, and pediatrician. And I'm the vice president of integrated care at Cityblock Health, which is a value-based care provider for communities with complex needs. My journey to medicine has been a long and winding road, but a really exciting one. And it's just trying to follow the needs in front of me at each step. You know, honestly, the beginning for me was I had cancer as a kid. And so I spent a fair amount of time, particularly for a year, seeing doctors, being in the hospital. And it was an illness experience that, obviously it was a tough year. But at the same time, it also opened doors to me that otherwise would not have been available to me. I later on worked with a doctor, so I got a job, honestly, that I wouldn't have had otherwise. I was able to join a cancer survivor group. And so sat in box seats at a professional basketball game, which, I was an immigrant kid. I didn't get a chance to do those kinds of things. And those were doors that were opened that are really special for a kid growing up. But also, I remember being exposed to disparities for the first time and, just getting an inkling of it as a kid. I remember being in the hospital, getting chemotherapy and having my mom there with me. But not every kid who was on the floor had their parents because their parents had to work, right? Or parents didn't have childcare. And it was a reminder that the illness experience very much is shaped by people's contexts. And that I was lucky in many ways. And so when I got to college, I volunteered with a teen group with teens with sickle cell disease. And, biologically, as we all learn in medical school, sickle cell disease, cancer, they all see pediatric hematology oncologists, right? There's some overlapping biology, but we know they're very different diseases, right? Socially, very different diseases. And that's because of the context, right? That's because of race. That's because of discrimination. And that was very eye-opening for me because the sickle cell teen group was resourced very differently than the cancer teen group, right? We didn't have the wealthy donors and the opportunities. And that really taught me from that age how important the social context was in shaping the illness experience. So, I kind of dove into social determinants of health and thinking about inequality. I changed from being a biology major to a sociology major, which my, immigrant father wasn't so understanding of, but it was the best decision ever made for me. Then I went to medical school, became a pediatrician, but really quickly, during my pediatric residency, saw how mental health and substance use disorders was the number one need for my patients, the kids in my clinic, but also their families. And so was able to do a second residency after pediatric residency and do adult psychiatry, then child psychiatry, then worked for the Dimmick Center, which is an amazing federally qualified health center and community health agency, both in the same campus, and work with people in recovery and, see the progress that can be made in treating substance use. And so got that experience and was able to qualify and apply for the Addiction Medicine Board. So it's been kind of a winding road in medicine for me, but a really exciting one. And at least in my head, it all made sense.
I love this story and the transparency. There are so many things we can kind of dive into. We might have to invite you back to talk about more. But just to hit a few points, the insight and the positivity that you have in terms of your lived experience of having cancer and being a cancer survivor as a child that led you into this path. And even then as a child, you had that insight to see people other than yourself and to see you were blessed and fortunate to have your mom there to support you and all those kinds of things. And everyone doesn't have that. So going from there and doing the volunteering and all of those kinds of things, and even going into the sickle cell groups and stuff, like seeing those disparities are really important to talk about. For the listeners out there, we record a little earlier, so this may be out next month instead of when we're actually recording it in February. But it just comes full circle because this week that there were just two major national holidays where it's National Cancer Day and National Sickle Cell Day. And of course, we need to talk a lot about cancers because it's becoming the leading cause of death, like even kind of taking over heart disease. And we need to put more research into this and have people with support and all of the different things, the treatments. But it also, this week was National Sickle Cell Awareness Week, and we don't talk enough about it. We don't have enough money going into it. The people who are dealing with sickle cell typically have very bad pain crises that you guys will learn about if you haven't yet, and they're not treated appropriately. And there was just a new gene therapy that came out, but there hasn't been medication like thrown at sickle cell for years. So it's just very important to kind of have that lens. And before we started talking, we talked about how we have a lot of crossed paths in terms of we both trained in Boston. So I've lived there for a while. And you mentioned the FQHC. So that's kind of when I fell in love with healthcare and fell in love with family medicine, which I do. And one of my mentors in family medicine was also an addiction physician, and just having that exposure to like everybody in the family needs those kinds of things. So it was really amazing to hear how you went into pediatrics after your lived experience and all the things like wanting to help the kids, but you knew that there needed to be more. So you ended up doing another residency, which a lot of people don't do. So kudos to you. And then getting the addiction medicine certification. So there is so much to unpack, and I'm kind of excited to chat about it.
Yeah, it's definitely been an exciting path, and really, learning from my patients, right? Seeing kind of what their needs are, and seeing if additional training kind of can help meet those needs.
Absolutely. And just for the students out there listening, like there is a long road ahead, no matter what specialty you choose, but there's also value in this story in saying that if you want to do something else, you can. So there's always opportunities for growth. So look out on that, because sometimes people get into residency or they get that 5-year itch after they graduate and become attendings. And they're like, okay, is this that? You can always go back and figure out something, because life is to be lived and is long, and you may have new interests.
Exactly. I think in medicine, we're taught to think about this one path. And, the paths in medicine have been around for a long time. But if we're meeting the needs of our patients, sometimes those paths are not the best ones to meet those needs. And what for others may seem squiggly actually might be straight in meeting the complex needs of our patients, right? Medical, behavioral, social needs. And the traditional pathway just actually may not be sufficient.
Absolutely. There's lots of room for change, hopefully coming in the future in medical education and the way that they structure it. So as you mentioned earlier, you realized from a young age that healthcare disparities are something that's plaguing the healthcare system. So as we mentioned, you recently became a board certified addiction medicine physician. So how has obtaining this additional certification kind of helped you meet those needs of the patient? And then for those who may be considering choosing a field and doing that later or something like that, do you know what types of specialties allow for that extra certification?
Yeah, we all know addiction and substance use disorders are a huge driver of disparities, right? We know a lot of the risk factors that drive poverty, inequality, racism can also increase the risk for substance use. And then, of course, there's decreased access to care as well. And so by creating a more just, better system and addressing addiction and substance use and recovery, we have an opportunity to improve care in our society. The certification is great. It was certified through the American Board of Preventative Medicine. And the nice thing is they require a primary specialty, and which really can be anything, right? From internal medicine, family medicine, pediatric psychiatry, anesthesiology, surgery, and then this is a layer on top of that. And so they realize, which I really appreciate and excited by, is that, addiction is everywhere, right? No matter what your primary specialty is. And so being able to layer that additional knowledge, studying, learning about the latest science, but also signaling to others, right, within your primary field, hey, this is something we all need to be better at. We all need to be more skilled. And signaling, hey, this is something that I got a little extra training on because this is important in our primary field. So, there are other paths like this, like palliative care and others. And I think that's really important, again, to meet the needs of our patients and break down some of these silos.
Absolutely. I couldn't agree more, because I feel as though, number one, there needs to be a greater focus on addiction because it bleeds into every facet of medicine. So we need to have people out there kind of advocating for it and even implementing some of those changes into the medical curriculum for students to learn about it earlier and learn how to care for people, as it is a disease for substance use disorder. When I had a mentor in medical school who was doing the addiction medicine, the way he explained it to me is, like, yes, we're learning about diabetes, we're learning about hypertension, and when we have someone who comes in, we're treating them. So we have to treat this as the same thing.
Exactly.
Because nobody, when you're going to like your show and tell in kindergarten, they raise their hand and they're like, okay, for career day, I want to be a doctor, I want to be a lawyer, I want to be a farmer or something. Nobody ever raises their hand and says, I want to be an addict. But it can happen over time, and we have to have these tools to help people.
Exactly. And, these different fields, they're created by medicine, and the stigma and inequality that's existed in medicine and healthcare over centuries is kind of baked into that. And so we have an opportunity now to, again, meet our patients where they are, right? And that's what I love about where I'm at now. And this really integrated whole person approach is, whatever someone is focused on, right? Someone might be focused on, hey, I'm trying to put food on the table tonight for my family. And that's part of health, right? And really focusing on that. And, maybe there's alcohol as part of the story there too. And maybe we'll get there once we build that relationship. But making sure that we as a team or as individual providers really have that whole picture and are able to provide that comprehensive whole person care.
I love that. Like, for the listeners out there, y'all know that's my jam. Like, from me talking about the pacemakers to you probably won't want to hear it again. But as you mentioned, you work at Cityblock, the first tech-driven provider for communities with complex needs. And you guys are kind of focusing on all of that kind of stuff. And it is tech-based. And we are integrating technology into healthcare, as we know, and we should, and it can help kind of move things forward, create access, create opportunities, all of the things, decrease disparities. How do you feel that we can utilize tech to decrease disparities and kind of address these social determinants of health?
Yeah, I think technology is an important part of the solution in addressing disparities and addressing social determinants of health. But what I love about Cityblock is that it's human-centered and technology-enabled, right? It's still about people. It's still about the relationship between a provider team and our patients. And at Cityblock, we say members instead of patients, and it's at every step of the member journey, right? So some of it is technology, predictive analytics, AI, being able to help predict, hey, who's going to need care in the next 3 months, 6 months, a year, so that maybe we can help predict and find those folks and provide that preventative care before someone ends up in the emergency room or on the inpatient unit unnecessarily, right? And really meet people where they are. So I think technology helps with that. And then technology can help increase access to care, right? For some, they might be able to use their phone, talk on the telephone, do a video visit. But for others, that may not be as readily available, either because they're in a shelter and the phone gets stolen, or there's an inconsistent data plan and so aren't able to do that. So then we have community health workers and nurses and paramedics even who can go to the home, provide that care in person, that face-to-face connection, but can also, take out the computer and call in the psychiatrist to come in and help out, or call in another physician to come in and help out. So it's really a multidisciplinary team to meet the complex needs of our members. And that's what I really love about being at Cityblock, is using the technology to provide that human-centered care.
You are preaching my language. Like, it's all about the humanism in medicine. Like, yes, we need to have the tech to help us, but like you said, there may be a digital divide. People still want that human touch, and we have to figure out new ways to address different things, because like you mentioned, like there are so many different factors out there. People love, and I used it just now to use the word, the social determinants of health, but really, like, that kind of helps us kind of frame it in our mind. But it's common sense. Like, people need food, people need shelter, people need safe neighborhoods, like they need money, they need education. So how can we work to come together to help them? Because 80% of the things that affects a human's like livelihood and health and all of those kinds of things are outside of the healthcare system. So how can the healthcare system kind of envelope that and advocate for our patients and help them?
Exactly. Those social determinants of health can be a little bit of a buzzword these days, but exactly as you're saying, it's common sense, right? Like, we all live in context, and we have to think of the whole picture to meet the needs of our patients.
Absolutely. So it's been such a joy to hear all of your words of wisdom and your journey and all of that. So we're coming a little bit to the close. I have a few more questions. And one of them I kind of love, and I wish that I had like a team of people to tell me this when I was in school. I love to ask the doctors, what is the one thing that you wish that you had known as you were entering medical school? Like when you were starting your medical career, was something you wish you had known?
Yeah. I think it's to always see patients. It's interesting. I've spoken with kind of more medical students, and I didn't graduate from medical school that long ago. But I think there is a concern about there's burnout and it's hard to be a clinician, and of course all of that is true. But seeing patients is really grounding, right? To be a healthcare system that is better performing, that better meets the needs of our population, I think it's a gift as a physician to be able to see patients, to hear people's stories, that trust that develops, right? And even being, one of the joys of being a physician is we're allowed to do some other things, right? Get other certifications, addiction medicine, get other degrees. I picked up an MBA along the way and learned, about finance and things. There's titles, administrative responsibilities. But if we're grounded in patient care, that helps keep us centered in the other activities, in the work, in the systems work that we're doing. And quite frankly, it also helps you build better systems, right? There's no better way to know whether something is working or not than if you're doing it yourself. So I think as folks are coming into medical school, just always being grounded in the experience of our patients, always continuing to see patients no matter what happens in one's career, and really being centered on that.
I couldn't agree more. We have a lot of different physicians that come on the show, and everyone's in their different stage of life. Some people are only seeing patients, some people are entrepreneurs, some people are coaches, all of the different things. And there is no, you have to kind of remember your why and why you've come and you've went through all of these things to care for people. And when you're looking back at your why at different points, whether or not it's when you're writing your personal statements for applying to medical school or your personal statements for residency, fellowship, so on and so forth, just looking back at them, and although they may change and evolve and your interests may change like yours did, there's always that core of what it is. And even for me personally, as y'all have all heard my tech story and all of the different things that I'm dabbling in, you have to have that time to kind of, if you want to build systems and you want to make an impact and all of those kinds of things, to kind of sit back and say okay, I may not have the time that I had when I was seeing patients full-time clinically if you decide to transition, but that day a week or whatever where you see them, it kind of brings it home. And it's okay, this is good. I still know medicine. I can diagnose things and make people feel better. It's that whole point of why you became a physician. So try to keep that in mind in directions of wherever you go, even if you are seeing patients clinically full time. I know in residency, one of my attendings they told me, especially in primary care, you see a lot of stuff over and over and over, and even in specialties, even more so, you see the same things. And it can kind of become okay, I wish I had a PowerPoint just to say my thing over and over on the wall. But no, you may have 20 patients that day, but for the majority of the patients that you're seeing, you're their only visit, maybe for like 6 months or the year or the day. So give them the time that they deserve and also get to learn them. And because even though they may have the same disease or something that someone has, they're all experiencing it differently through their own lens. So take that time and make people feel human.
Exactly. And it's a big deal to see the doctor, right? Like it's still a really special thing to see the doctor, even with everything going on in healthcare and in the world. And to be present and to be grounded in that is really powerful for the patient in front of you and is really powerful for us as physicians.
Absolutely. So my final question for you that I also love asking guests, because the answers are so diverse. We know that our healthcare system is not perfect. We need some changes. What's something that you would change about the healthcare system if you had a magic wand?
Yeah, to me, it's all about alignment. And this is what I really love about Cityblock is that we're in this really special location of being a value-based care provider, having integrated medical, behavioral, substance use disorder, and social care, and to be aligned around what our patients need, right? So much of our healthcare system is aligned around other things, right? Oh, well, this is how we get paid, right? That's a fee-for-service model. This is how medical providers get paid. This is how behavioral health providers get paid. This is how substance use gets paid, which is all different funding streams, of course, right? This is how social gets paid, which mostly doesn't get paid in our healthcare system. And so it's really aligning around systems or sometimes aligning around providers, right? Why do we see patients in clinics, right? It's easier for the doctor. And obviously there's efficiencies built into that. But for some patients, it doesn't make sense to see them in clinic. We should be going to their homes, right? We should be turning back the clock and doing it, 19th century style and going to their house and saying, hey, how can I help you? And spend hours with that patient because A, that's the right thing to do. And B, that's actually better for the population health and better for the healthcare system. We can actually save money by doing that remarkably, right? If we're doing the right interventions with the right patients. And so the traditional system doesn't support that, even though it makes sense, right? Even though it's the right thing to do, it's right for the patients, it's right for the system, it's right for our society. We don't do it because our systems haven't gotten to that place. And that's what I love about Cityblock and value-based care is we are now at that place where we can be centered around what our patients need, not about what the system has been doing for decades or centuries.
I love that. Like that needs to be the word of the year, alignment.
Yeah.
Like think about that in terms of the healthcare system. Think about that for you guys who are applying to school in the next year or choosing your match, all of those kinds of things. Is it in alignment with whatever you need? So yeah.
Exactly. And, and aligning means listening to folks and seeing kind of where they are in the system with our patients and our colleagues and being creative and thinking about, hey, how can I help you meet your needs while also meeting other people's needs in a way that's sustainable and makes sense. And so there's different skills than we might learn in biochemistry to do that. But we have an opportunity as physicians to learn those skills along the way.
Absolutely. Well, it was such a pleasure for you to join us today. I just want to give you an opportunity to tell the audience goodbye as well as let them know where they can find you.
Awesome. Well, again, thank you so much for having me here today. It's you have such a great podcast. I really appreciate all the work that you do. And I can be found on LinkedIn, and people can always reach out to me by email, michael.tane@cityblock.com. So thank you all so much. Thank you for having me here today.
Thank you. It's such a pleasure. So for all of the students listening out there, definitely share this with your friends. I think that this episode was something that we all need to know and have a reminder about like why we're doing what we're doing. And you can, if you have any suggestions for any topics or any guests, you can always reach out on my Instagram, Dr. D Graham, DOCTOR, the letter D, and Graham, GRAM, or on LinkedIn, my name is Erkeda DeRouen. And we'll be back again next week with another fantastic guest. Bye.
Bye-bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.